Welcome to The Explainer. Today, we're going to talk about something that's, well, it's a huge source of relief, but it also opens up a ton of complex questions. We're talking about cancer remission.
For anyone who's ever faced cancer, hearing your doctor say these words, it's just about the most powerful thing you can imagine. It can really feel like you've crossed the finish line, right? But it's so important to understand the difference between what our tests can actually see and what might still be hiding. This all gets summed up in this one phrase: no evidence of disease, or NED for short. And what that really means is that standard tests can't find any cancer. But, and this is a big but we're going to get into, being tumor-free isn't necessarily the same thing as being cancer-free. Okay, so here's how we're going to break this down. First, we'll get into what remission really means. Then, we'll look at the hidden survivors that can cause a comeback. And after that, we'll explore a whole new strategy for staying healthy long-term.
All right, first things first. Here's the critical thing to get. Even our best technology, things like CT and PET scans, they have their limits. They can only spot tumors once they've grown to a certain size. We're talking a few millimeters. What does that mean? It means millions of cancer cells could still be hanging out in the body, even when every single test comes back clean.
And that right there brings us to the heart of the issue. There are basically 4 types of hidden threats that can stick around, even when those scans look perfect.
Okay, first on the list is something called minimal residual disease, or MRD. Think of these as tiny microscopic clusters of cancer cells that somehow survived that first big wave of aggressive treatment. There are so few of them that they're completely invisible to scans, and they don't cause any symptoms, but they're still there, just waiting.
This analogy is actually perfect. It's like you've deep cleaned your house, right? It looks spotless. You've vacuumed, you've wiped down every surface, but there are still those tiny hidden crumbs in the cracks that could cause a problem later. That is MRD. Next up, we have micrometastases. These are these tiny little clusters of cells that actually break off from the original tumor and travel to other parts of the body. You can think of them like seeds, just scattered around, waiting quietly, sometimes for years, before they suddenly wake up and start growing.
And then there are the cancer stem cells. These are the ultimate survivors. Seriously, they can rebuild the entire cancer from just a handful of leftover cells. And what makes them so tough is they are incredibly resistant to treatments like chemo and radiation. The best way to think about these guys is like the roots of a weed. You can pull out everything you see on the surface, but if you don't get every single piece of that root system, that weed is just going to grow right back. And that leads us to our final hidden threat.
And last but not least, we have a failure of what's called immune surveillance. See, cancer is so clever at hiding. It can actually put proteins on its surface that are like a little sign saying, "Don't attack me," basically tricking your body's own natural defenses into leaving it alone. So, once you understand these 4 threats, it really points to a whole new way of thinking about this. It's about moving away from just watchful waiting, and instead getting proactive, actively going after the very conditions that would let cancer make a comeback.
Now, research is pointing to 3 complementary therapies that can really address these hidden survivors. And look, it's really important to say this is for informational purposes only. You should always discuss any kind of treatment strategy with your own qualified medical professional.
So the first approach is an oxidizing therapy that uses something called high-ozonide oil. Imagine those tough cancer stem cells are wearing a suit of antioxidant armor. Well, this therapy basically strips that armor away, leaving them totally vulnerable. And what's really key here is that it also gets rid of the low oxygen signal that can act like an alarm clock for those sleeping micrometastases.
Okay, this next one is really fascinating. It's a very precise microdose of resveratrol and copper. So get this, when cancer cells die, they can release this toxic debris that, ironically, can actually fuel more cancer growth. This combo acts like a special cleanup crew, just neutralizing all that junk. Plus, it helps unmask the hidden cancer cells by tearing down those "don't attack me" signs so the immune system can finally see them.
And the third intervention is something called alkalinization therapy. Cancer cells just love to create this super acidic environment all around them. That acid is like their shield and their weapon. It helps them grow, invade other tissues, and hide from the immune system. So this therapy does something pretty simple but powerful. It just neutralizes that acid. It completely changes the battlefield and takes away one of cancer's most important tools for survival.
And the potential impact here, it's huge. There was one study on patients with stage 4 pancreatic cancer, and it showed that the ones who were able to successfully use this therapy to neutralize that acidity, they lived almost 4 times longer. That's pretty incredible.
So the really critical point here isn't just about using one of these things. It's about understanding how they all work together. Each one tackles those hidden threats from a completely different angle. It's like you're creating multiple layers of protection.
Yeah, you can really think of it as building a fortress against a comeback. These therapies all work in concert, right? First, they weaken the strongest enemy cells. Then, they neutralize all the hidden threats. And finally, they unmask any cancer that's left so your own immune system can swoop in and do its job.
You know, all of this leads to a really powerful shift in how you look at things. Getting to remission is without a doubt an incredible milestone. And having this knowledge, it just empowers you for that whole next chapter of your health journey.
So, what's the big takeaway here? It's that understanding no evidence of disease isn't the end of the story, and that knowledge gives you power. By going after those 4 hidden threats with strategy that has multiple layers, you can switch from just being a passive observer to being an active participant in your own health. You can start asking smarter questions and having really empowered conversations with your medical team about your long-term health.
So instead of looking at remission like it's the finish line, maybe we should see it as the starting line, the beginning of a brand new empowered strategy that's all about prevention.
And that really leaves us with one final thought to chew on. What if the most powerful phase of the entire cancer journey actually begins on the day you're told you're in remission?